A very good afternoon to all of you. At the outset, I'm very happy that today's event is being housed in Bangalore. You have selected this place to be the place for deliberating on issues, particularly on AI, machine learning, in oncology. And I'm very glad that we have a huge partnership between government, academia, and the health professionals, because that is the best way to get the best out of ASCO or any other initiative for that matter. We are today facing this issue of huge NCD incidents. Government of Karnataka maps all the deaths with causes, and after COVID, it's been a very, very alarming increase in both heart, cardiac-related and cancer-related deaths. And as the statistics show, that not even 50% of the cancer patients are fully cured by whatever technology, whatever knowledge that we have at present. Therefore, there's half the journey yet to be covered. And it can be covered only when we all come together in a partnership mode and get the best of all initiatives and then put it together for the best of all the people in the world. I'm very proud to say that Karnataka, and for that matter, Bangalore, which is known as the Silicon Valley of India, is the global powerhouse of both innovation and technology. Meditech has also been one of the front runners in innovation and technology. With more than 50 universities in Karnataka, 50% of the talent in AI and ML of the country comes from here. This is a real matter of great pride. And this huge talent pool that is available here has to be now geared into and steered into the focused research, the focused areas of improvements that all of us are looking forward to. As an administrator, I feel that it is both accessibility and affordability which a common man is concerned, any disease for that matter. Today in Karnataka health system, we have ensured that every person above 30 years of age is mandatorily screened. A very simple questionnaire has been prepared. As you know that for every 1,000 people, there is one ASHA worker. And she has been trained in administering this questionnaire to every person. And through that score, we understand whether the person has a symptom or a risk factor leading to any of the NCDs. And after this screening, at the PHC level, the further risk assessment is done. And then at the community health center, the diagnostics, the preliminary diagnostics are available. For example, dental issues, say oral cancer. We have the dental facilities right from community health centers, which is more like a village level thing. And then as we move on, we are having the taluk hospitals and district hospitals, which cover, again, the preliminary part of it. And only when it is it requires the intervention of a specialist, are they referred to the government hospital, which Kidwai and its hub and spoke model is taking care of. And also we have more than 350 empaneled hospitals who at a particular rate are providing services, diagnostic as well as curative services. We have also this scheme of Ayushman Bharat, as you know. So up to 5 lakh, the costs are covered. But the problem is that if a person is diagnosed with cancer at different levels, stages, the costs are much, much higher. So the question of affordability, so this is accessibility that I've spoken. The affordability part is a very big concern today for a poor person. And let me tell you, it is just the 10% of the population who are able to afford the multi-speciality, super-speciality hospitals. We have more than 100 of them in Bangalore. That's okay, but not everybody can afford. And then it becomes a more of a killer disease, that it kills you financially actually. So whether that person has that strength of going through the entire protocol of treatment, whatever is available today, and then with 50% chances of survival, is a very, very big question that today all of us need to deliberate upon. Today, the Tata Institute of Sciences has come out with prices which are much, much lower in terms of all the chemotherapy and other drugs. That is one very good advancement, because chemotherapy alone is such an expensive affair. And it can be administered at taluk and district level, so not everybody has to rush to super speciality hospitals. This is one part. But we need to know more about the root cause of it. Today, I think most of us are clueless about why it is happening. Earlier, we used to have, some aspects. Okay, because you have this, therefore some items are genetic, some are related to something else. But I think today it is, I don't know whether AI and ML has also helped today in terms of predictive analysis. Can you predict really that that because of this set of characteristics, a person's lifestyle or other genetic factors, you are going to have you're more vulnerable to having cancer. I don't think that has still happened. And even if it happens, what is it that we are doing to prevent it? Yes, by early screening, we are able to prevent to a large degree. But once the person has crossed that stage, we really don't have a sure shot kind of a treatment available, which is again affordable and accessible. That particularly, I think, is the question where government, academia, and the health professionals need to work together. I have requested the Vice Chancellor of Rajiv Gandhi Health Sciences to look at an integrated approach. Is today, for example, in this session, you're talking of immunotherapy. Yes, it's a new wave. Maybe it has an ray of hope. But then ultimately, we have to strengthen the body's own immunity, body's own health parameters, so that we don't fall a prey to one or the other. Yesterday it was COVID, tomorrow it will be something else. So whether the lifestyle changes, whether the food habits, whether the mind-body connect, all these aspects, are we looking at it in an integrated manner? Because I personally feel that no single science can give us a definite solution. We have to look at a collaborative approach, an integrative approach, and I'm sure with the kind of talent that we have, and all of you are here, you're sparing your time, your weekend over these deliberations, Bengaluru, Karnataka, and ASCO, and all the relevant stakeholders, let us show the way to the world. Let us become the pioneer in finding the best of solutions available in oncology. I wish you